All right, welcome to our 2021 Healthcare for All West Virginia Summit. We are a research-based grassroots organization in operations alongside a coalition of nonprofits, including the West Virginians for Affordable Healthcare, West Virginia Citizen Action Group, and the West Virginia Center on Budget and Policy. And we'd also like to take just a moment to thank the RX Foundation for their generous funding throughout the year. This allows us to continue the fight toward Medicaid for all and affordable health care for all West Virginians. All right, and just a couple of webinar reminders and some etiquette reminders here. The webinar is being recorded. Closed caption is available. And please remember to mute your microphone so panelists can be heard at all times. Questions can be sent at any time via chat to panelists or everyone using that feature. And please use the raise your hand function at the appropriate time for questions if the chat is not accessible to you. All right, and thank you for joining us. Please remember to follow us for all future events at HCFA WV is Healthcare for All WV on Twitter, or you can like us on Facebook, excuse me, with Healthcare for All WV. All right, I'm just getting out of this tech thing here. Hopefully I'll stop share correctly. All right. So let's go ahead and get this party started. All right. Again, welcome to this virtual summit. My name is Dr. Adam Starks, and I am the Barber County Healthcare for All coordinator. And I joined the Healthcare for All movement last year to progress affordable healthcare access for all West Virginians. As someone who has had healthcare my entire adult life, always employer-based healthcare, and still landed tens of thousands of dollars in medical debt. Regardless of that, it has been an issue that's been near and dear to me, and something that has always worried me for other people who may not be as fortunate to fork over a good percentage of their paycheck to medical bills. In an ideal world, we would have Medicaid for all, and we'd be face-to-face for this event. Unfortunately, neither are the case, so we continue the good fight towards an ideal system for all Americans while adapting to today's circumstances due to COVID-19. For everyone's safety and well-being, of course. We will prevail on both fronts, I have no doubt about that, and that's why I'm excited for our next chapter. While COVID-19 has exposed many of our healthcare system's flaws, from class divide to racial inequities, challenges arise opportunities. And you will hear from varied expert panelists tonight about some possible solutions, and I am excited to hear from them. But before we get started with that, we are going to turn this part of the presentation over to the legendary Kat Stoll.
Yeah, thank you, Adam. And of course, I forgot to unmute myself, and I apologize. Welcome everyone who's joining this webinar. And thank you so much to Adam, but also the whole Healthcare for All team. It's interesting, I think we all come to this work for personal reasons. All of us have faced periods in our lives when we struggled to pay for our healthcare services that we needed, and we have families who have made that struggle. So I'm Kat Stoll. I'm the Director of Health Policy at West Virginians for Affordable Healthcare. And I just want to quickly mention that my organization, which is one of several in this coalition, West Virginians for Affordable Healthcare, was founded back in 2010 to advocate for our state to quickly opt into the Medicaid expansion under the Affordable Care Act. And we are so proud that our state was one of the very first to expand Medicaid for adults. That expansion meant going from an income eligibility level of $5,000 up to $13,000 for one adult, a huge leap forward. And it also allowed adults who didn't have dependent children to qualify for Medicaid for the first time. So we were founded to fight for good policy in our legislature, and we're proud of that initial accomplishment. So jumping forward in history, the Healthcare for All Coalition, which has a number of organizations that belong to it besides my own, including West Virginia Citizen Action Group and West Virginia Center on Budget and Policy. We have all scored together some very important health policy wins. You know, these advocacy battles can literally last for many years, but we have persevered. Just want to highlight a few of our wins to give you a sense of the effectiveness of this coalition effort. In 2020, we won a dental benefit in Medicaid, extremely important for the overall health of Medicaid enrollees. And now we're beginning to fight for a Medicaid vision benefit, so folks can afford glasses and contacts. You can hear more about that tomorrow night. Our most recent West Virginia legislative session was 2021, and it was a wild ride down a West Virginia Whitewater River. If you go to our website, WVAHC, or Healthcare for All's website that Adam shared the link with you, you'll find a legislative highlights document that describes all the wins and losses we had around health policy, but I'm going to just share a few of our wins. The first one, well, even before I do that, you know, I just want to share with folks and remind them that our state legislature right now has a supermajority of Republicans. That means at least 2/3 of all senators and 2/3 of all our delegates are Republicans. And that gives one party a lot of control over what bills can pass and what bills don't. And it means, and it really underscores the importance of working in a coalition. And a coalition like Healthcare for All is essential to getting any success in the legislature. So last year we had a big win. After I'd say at least 5 or 6 years of advocacy and education, we passed a bill to extend the Medicaid CHIP program for postpartum coverage from 2 months to 12 months. And it was for all women up to 300% of the federal poverty level. That's about 38,000 for a one-woman household. And you can't, I don't think I have to explain how important this is. If you can imagine being a new mom and losing your access to a doctor or treatments or medicine, you need just 2 months after having given birth to a baby. That's just crazy. So now new moms, thanks to our work, can keep their own health services for a full year. They can stay healthy and they can take on the responsibility of taking care of their new baby because they can take care of themselves. Huge win for us. In addition, in 2021, we achieved the introduction. We have not yet passed it, but sometimes getting the battle started is half the battle. The introduction of a Medicaid buy-in bill, and it was sponsored by Republican Delegate Evan Worrell from Cabell County. The bill has attracted a lot of interest and a lot of support from both Republicans and Democrats. You'll hear more about the Medicaid buy-in bill that we had introduced in this past session tomorrow evening. But basically, it allows folks who hit the so-called Medicaid income eligibility cliff the opportunity to pay small premiums to keep their Medicaid coverage. So they don't need to hold themselves back from getting a raise or more hours for fear that that income will go up enough to knock them off Medicaid. This is a program that helps people work, and you're going to hear a lot more about it tomorrow evening. Back in 2020, we successfully passed a bill to put a $100 copay cap on insulin for folks with diabetes. And never satisfied with that victory, in 2021, we introduced a new bill to lower that copay to $25 and also add copay caps to other diabetes-related drugs besides insulin, and also cap what you have to spend on supplies and equipment when you have diabetes. We didn't pass the bill, we came close. I want to give a huge shout out to Delegate Barbara Fleischauer, who championed the 2020 bill that we did pass and worked closely with us in 2021. We're going to keep working on this bill. It's in our health agenda. You can hear more about it tomorrow night, and we'll work with Delegate Fleischauer, who may be Senator Fleischauer, perhaps. Sometimes, particularly in the environment we're working in right now, stopping bad bills from passing is also an important victory for us. In 2021, we had a huge victory when we stopped a proposal to phase out the state personal income tax. And again, this was stopped with a broad coalition effort, important work by our colleagues at the Center for Budget and Policy here in West Virginia that Rhonda works with. Phasing out a tax kind of sounds like a good thing on the surface, but you've got to remember that low-income families pay little or no in state income tax. And wrapped into that proposal was another proposal to raise the retail sales tax to 8%. And if you think about that, this proposal would have actually shifted total tax burdens from the wealthy in West Virginia to our poorest families. Altogether, this proposal would have blown enormous holes in our state budget, would have forced us to cut Medicaid, cut public health, and cut every other program in the state budget. Think parks, recreation, public schools, higher education, road and bridge maintenance, but certainly Medicaid and the health programs we care about. Those cuts didn't happen. This proposal did not pass, and I think this coalition played a key role in stopping this proposal literally in the last minutes of the state legislative session. And I just want to mention one other victory. We killed a bill that would have made it harder for low-income folks who have to go to the hospital to quickly qualify for Medicaid coverage of their hospital bills. It's called presumptive eligibility. This was a really important victory. That would have been a very, very dangerous bill to see pass in our state. So I could highlight some other things, but I'll stop now. I want to say that progress can be slow. It can take years to move forward a few steps. It can be really frustrating. But the key, I think, and why this coalition is so important is that we keep on moving forward with our eyes on future goals. And at the same time, we're able to pivot and fight to not be pushed backward by some bills or negative policy that's proposed. So this coalition is really the leaders in the state in keeping our eyes on the goal for what we want to accomplish to improve healthcare access, affordability, and quality in our state. So thanks so much. I hope that I didn't go too long, Adam.
It was perfect and very informative. Thank you very much. All right. Now we turn it over to our executive director, Mr. Gary Zuckett. He is going to lead tonight's panel discussion. Gary, the floor is yours.
Thank you very much, Adam. As Adam said, my name is Gary Zuckett. I'm executive director of West Virginia Citizen Action and one of the partners of the Healthcare for All Coalition here in West Virginia. And it's my pleasure to be able to introduce and moderate the panel for tonight. And we have quite a stellar team of panelists. The first one being Jeremy Smith, who is the program director for the West Virginia Navigator as a division of the First Choice Services. He will be telling us about open enrollment in these different programs in the Affordable Care Act, in the Premium Tax Credit, and Medicaid eligibility. So Jeremy, tell us a little bit about yourself, and then we'll get it started with some questions.
Yeah, absolutely. Thanks for having me today. So like you mentioned, my name is Jeremy Smith. I'm the program director for the West Virginia Navigator program operated by First Choice Services. And if you're not familiar, First Choice Services, we're a nonprofit organization based in Charleston, and we run we run most of West Virginia's social service helplines. So we run the Help for WV helpline, which serves as the addiction and mental health helpline, the suicide lifeline for West Virginia, the tobacco quit line, the gambling addiction helpline. We have an emotional support line where people can call and talk to crisis counselors for free. We help answer 211 calls, Jobs and Hope, and we do some similar type lines for some of our surrounding states. And the one common denominator for all of those types of services is that people need health coverage. If they don't have health coverage, they often can't get the services that are out there for them. So we got back in, or we first received what's called a Health Insurance Navigator Organization grant back in 2015. And I'd already been in this work for a long time. I've been a navigator since the Affordable Care Act was launched in West Virginia back in 2013. And, you know, been on the front lines, traveling the state, letting people know about these healthcare options that was rolled out. And so we've been operating this program for a number of years, and we've seen the ups and the downs. And if you're not familiar with what a navigator organization is, it's a grant-funded program from the Centers for Medicare and Medicaid Services just to provide free assistance to in-state residents to help you find and get signed up for health coverage. So we help people sign up for Medicaid, CHIP for kids, and then of course the plans on healthcare.gov on the health insurance marketplace. So it's a really great program. And several years ago, we had a pretty good program running. And then over the last few years during the Trump administration, we saw that program got cut pretty bare bones. And we was able to survive those years. And we actually just got word a couple months ago that we were selected for a 3-year renewal at 10 times the amount of funding that we was operating at. So we're really happy to be able to continue this service and bring on a lot more capacity to go out there and help people. So at this point, we've been able to hire on 10 new navigators and open up remote office locations in Huntington, Fairmont, and Martinsburg. So we will have those in-person assisters around the state, and then we will continue to run a statewide helpline where people can call and get assistance over the phone, whether it's just a quick question or if you need full enrollment help to sign up for Medicaid or Marketplace. And to be honest with you, the Marketplace is stronger than it has been in a long time. The American Rescue Plan that the Biden administration passed, it put a lot of significant help in there for the Marketplace in the form of increased subsidies. So the prices are lower automatically for anybody that has Marketplace coverage. We saw most people's premiums go down by 30 to 40% this year after they got those increased subsidies. They also removed the cap. It used to be that if you're 400% of the FPL, after that you couldn't qualify, but you know, now they've removed that cap. So we're really happy to continue this help. You know, I'll be talking more, but if anybody wants to look more at us, you can go to acanavigator.com. So that's kind of just a summary of what we do and the work that I'm doing.
Wow, that's really a lot. And I'm so pleased to hear that you've gotten refunded and you'll be expanding your services. So got a few questions for you in regard to those services. What will your team of navigators be doing to make your services more available in communities of color and other underserved areas?
Yeah, so we just got this expansion and we're getting everybody hired on and trained, but the outreach to communities across the state is going to increase significantly. We hope to be at every fair and festival out there handing out information. We're hoping to work with you know, a lot of other nonprofit organizations that assist vulnerable communities. give presentations, work with churches, and then just do specialized enrollment events where we might come into a certain community and advertise that we'll be there that day, and people can show up and be able to sit down with one of us face to face. Another addition to the program is we're going to be able to help people speaking Spanish this year. We've been able to bring on a Spanish speaking navigator, and anybody that speaks Spanish in the state will have access to be able to get that enrollment help as well. And then, of course, a big part of some of the more vulnerable people that we do help is because of our work on Help for WV, we're able to help a lot of people that are dealing with substance use disorder. So we are able to get them insurance so that they can get treatment. And we're really proud of being able to continue to do that kind of work, and we hope to expand it even more.
Super. I understand that you also work with volunteers. And next question for you is, how can volunteers receive the training to help individuals in their communities enroll in Medicaid and the Affordable Care Act, the state insurance marketplace? And how could this process be made easier for both navigators and applicants?
Right. It could definitely be easier. The way that the feds and the state has it set up is it's really hard to be able to get volunteers that work for us access to be able to do the actual enrollments. It used to be the state had what was called community providers, that you could take some state training and do Medicaid applications for people. Currently, they have that closed. Marketplace as well, they've got it set up to where, only the Navigator organization themselves can do the enrollments. That being said, I've worked with a number of people that's on here today, and what you can do really is just send people our way or approach us with ideas for outreach or certain enrollment events in your community where we can come in and work with you and you might be able to help promote to your community that we'll be there that day, and then help get the word out and help us with the event.
Yes, I recall we've had you and your crew show up at several of the events that we've hosted over the last year or so. And hopefully as COVID winds down, people will be getting together more, and that'll make it more available. I got one last question for you. If you could remove one barrier to enrolling people in Medicaid or the Affordable Care Act marketplace or the advanced premium tax credit, what would you change?
I think this is a common theme in our society across the board, and it's fighting misinformation. Right now, if somebody, as most people do, their first instinct is to do a Google search. And if you Google search health insurance options, it's very likely that you're going to fall down a rabbit hole of somebody that's trying to sell you what's considered a junk insurance plan. And they put you on these telemarketing lists, and these people call and promise you the moon. And then if you actually sign up for it and you look at the details, it's not full insurance, or it's not a good Medicaid or a CHIP plan. And so what I really hope that people can do is get connected with a navigator. There was a study that came out recently that said those that work with a free assister are about 50% more likely to sign up for a health insurance plan that they like. So I really just encourage people to use these free programs to sit down with somebody and figure out their options versus doing a Google search and falling down that rabbit hole.
Well, thank you, Jeremy Smith, and thank you for being a navigator and helping folks navigate this sort of complicated maze of public and private insurances. We really think you're doing the Lord's work there.
Thanks.
I'm going to move on to our next panelist. I'd like to introduce to the listeners Rhonda Roganby, who's the health policy analyst with our allies at the West Virginia Center on Budget and Policy. Rhonda will be talking about health equity in West Virginia, especially in the light of COVID-19 pandemic and the critical need to protect our social safety nets. Rhonda, would you start out by telling us a little bit more about yourself.
Sure. Hi, everyone. I'm Rhonda Ragambe. As Gary mentioned, I'm the Health Policy Analyst at the West Virginia Center on Budget and Policy. Over the past year and some change, I've focused on looking into the Medicaid program here in West Virginia and just learning all that we could about it, and the ways in which it's working for West Virginia, the ways in which it can be improved to promote health equity across the state, and just learning more about people's experiences. Furthermore, I've been working on the social safety net, specifically around SNAP and TANF, and how those interact with Medicaid. And more recently, the child tax credit. So yeah, I'm really happy to be here tonight. Thank you for having me.
Well, we're really interested to hear more of your expertise from the Center on Budget, which is a real excellent place to get real facts and figures on things. So, so speaking of that, how many people in West Virginia does Medicaid cover?
As of August 2021, Medicaid covers 596,000 West Virginians. That number has increased significantly since the start of the pandemic due to changes at the federal level to ensure that people across the country could continue to have care. And so states right now are not removing people from the rolls, but also just the economic hardships that we've seen through the pandemic has also contributed to the increase in the number of folks in West Virginia covered. But we know it's so important. It covers half of births in West Virginia, it covers half of children, and it covers about 76% of long-term care. So it really touches so many lives here in the state, and continues to be a really important insurance program.
Yes, ma'am. And the Affordable Care Act had provision in it actually that expanded the Medicaid program here in West Virginia way back when the previous governor was in office, and that really helped out a lot too. So through your research with the West Virginia Center on Budget and Policy, what are the changes that Medicaid underwent in response to the pandemic? You covered some of that already.
Yeah, so the first thing was that there was an FMAP increase, or an increase in the federal match rate for Medicaid. And that was across the country, but here in West Virginia, it took our federal match to just over 80%. And in exchange for that, as I mentioned, states are not allowed to remove people from the Medicaid rolls through the public health emergency. So in addition to having more people covered, there are additional funds that are that the state is receiving, and they are able to use those funds to provide in different programs. So I think those are the main changes in the Medicaid program in response to the pandemic.
Yeah, and thank you. And to dig a little bit deeper, what are some of the lessons that we learned from the pandemic?
I think Kat mentioned that the pandemic illuminated a lot of the gaps that are existing in our healthcare system, but it has also provided a lot of opportunities for just seeing the program more clearly and seeing what gaps there are. I think one of the biggest takeaways is that Medicaid is such an important program in West Virginia, and there is more to be done, but we expanded telehealth, which was crucial as we were staying at home for a really long time. We are working on mental health services and harm reduction. And we saw, increases in patterns across the state of people having mental health crises, also in response to the pandemic. So I think between those three things, telehealth, mental health services, and harm reduction, are just three small areas, or rather really large areas that were illuminated during the pandemic. But just furthermore, just how important the program is in our state, and some smaller, more specific ways that we can improve it will help promote health equity across the state as well.
Thank you, thank you. One last question for you, then we'll let you go. We have recognize that there are disparities in our healthcare outcomes in our healthcare system in West Virginia. How can we promote health equity in West Virginia?
I think it's gonna be a lot, but I think, challenging our own biases when it comes to care and who's deserving and how it manifests. I think talking with communities directly and learning from lived experiences, whether that is people who are enrolled or, talking directly to experts such as many people on this panel here tonight. And then just working alongside our coalition members and communities and decision makers to start filling in some of the gaps that we've observed, not only in Medicaid, but throughout our healthcare system and across the social safety net.
Yeah, and I thank you. And I would like to remind folks that tomorrow evening, day 2 of this healthcare summit, we will get into some of the policies that might help on that disparities front also. And I want to thank Rhonda for her expertise here. And I'd like to just remind all of our panelists that we'll have a wrap-up question at the end, so stick with us. And next, I would like to introduce Julianne Iacovani, who is the Director of Child Health for one of our groups here at West Virginians for Affordable Healthcare. Julianne will be talking about children's health and resources around substance use disorder. So, Julianne, why don't you tell us a little bit more about yourself, and then we'll get started with a few questions.
Thanks, Gary. Hi, everyone. I'm over at Kids Health for West Virginians for Affordable Healthcare, and we are currently focused on the mental health needs of West Virginia kids. We have been wanting to do something to focus on improving access to mental health care for our kids for quite a while. We decided to host a Kids Health conference with a focus on mental health, which will take place the first week in November. We know suicide attempts have increased among youth during the pandemic, but even before the pandemic, suicide rates were steadily increasing, meaning that death by suicide is now the second leading cause of death among young people. Recently, the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, and the Children's Hospital Association have come together to declare a national state of emergency in children's mental health. There will be a session on the mental health needs of children and parents in active addiction. We know that having parents with substance use disorders can add to childhood trauma and increase a child's adverse childhood experiences. As of 2017, 28 out of every 1,000 children in the United States were affected by opioids, while in West Virginia, 54 out of every 1,000 children were affected by opioid use. So today we are going to skim the surface on what we can do to support children and families impacted by substance use disorder. Thank you so much for having me, friends.
Yeah, we're really glad to have you here tonight. So to start with some of the questions we have for you. First off, what new services should Medicaid and the Children's Health Insurance Program, or CHIP, cover to help support youth and families and youth and parents and families impacted by substance use disorders, also known as SUDs?
I think I'm going to go with either childcare or transportation, which I realize those are social determinants of health. I feel this is a big category, substance use disorder. And when you start trying to break it down, you have to get into the details. Does this human not only have the services covered they need as far as the treatments and facilities they need? Do they have access to the mental health care providers and programs to support them after or during treatment? And will the providers that they have access to accept Medicaid? I've had a lot of conversations with therapists and counselors lately who are not interested in accepting Medicaid because of the low reimbursement. So the conversation has been around fair reimbursement rates for providers and maybe setting reimbursement rates to ensure fair payment for providers. But continuing to answer this, what else is proven to impact addiction that rural families don't have access to? Do they have access to affordable, healthy foods for themselves and their family? Do they have access to affordable, safe living spaces post-treatment or even during treatment? Do they have access to affordable childcare? I have heard of so many stories of single moms who want to get the treatment they need. They have access to that treatment, but they don't have anyone to care for their child while they attend treatment, even for outpatient treatment. And then you hear back a few days later that they've overdosed. They wanted to stay with their child. They wanted to take care of their children. They wanted to be healthy. It would be ideal for families to stay together safely and receive the help they need. Telehealth is a great tool, especially for such a rural state, but not all treatments can be administered virtually for substance use disorders. Should Medicaid be responsible for addressing all of those issues? No, but we do have options and we should explore them. I do want to say overall, I think our MCOs are doing a great job meeting the needs of what they are currently responsible for.
Well, thank you. Yes, the child care is a really big item, and that's one that's being hopefully addressed in some of the federal policies that are being debated in Washington, D.C. right now, along with the paid family leave, so we can take care of kids and elders and things like that. So hopefully some of that will come down the pike too. Next question for you. What is the importance of the school-based services for youth that are impacted by substance use disorders in their families, who themselves may be using?
This is a great question. After participating in different projects with the schools, hearing back from teachers, they want and need access to these additional programs and resources. They should not, however, be responsible for providing them. We are all well aware that there is so much pressure on West Virginia teachers to wear so many different hats. Right now, as with everything, COVID has made outside access to schools difficult. Some of the programs currently happening in West Virginia that help address some of these needs are the West Virginia Drug Intervention Institute's the RX program, which works to educate young elementary age students on not taking prescriptions that aren't prescribed for them. Handle with Care, which helps notify the school if the child has had a recent traumatic events. The West Virginia Students Against Destructive Decisions program, which is a peer-to-peer leadership and development program. There is a desire to see family treatment courts across the state, which are designed to protect children and protect parental custody while parents receive treatment. I would have to say school-based healthcare needs to be a priority, especially for those students who are participating in drug use. Again, we have a very rural state, and having access to healthcare at the school or close to the school would help with transportation and with privacy. Again, I'm going to bring it back to mental health care. We need mental health providers in the schools right now. Our providers are stretched very thin and often cover multiple schools. That is not ideal for the providers or the students. We need to be actively working to keep providers in state and acting on what we can do to encourage participation in the mental health care fields, not just on a state level, but on a national level. We have so much trauma in our schools because of the opioid epidemic and everything that is connected to it. It would help students, families, and teachers to have access to this care in the schools. I know that was a very long answer. I'm sorry.
Well, it's a very complicated situation. You didn't mention, confidentiality, and I think, can you talk a little bit more about the importance of confidentiality for children who report substance use disorder issues in their home lives, and what thoughts can you share regarding the difficult balance of protecting the child with confidentiality and the need for intervention?
So I will try and keep this answer shorter. So in a healthcare setting, I feel most of us believe it's a human right to have our providers maintain confidentiality. When a child shares something with you, especially about substance abuse in the home, it's because they deemed you a safe person, someone they can trust. That being said, confidentiality is not always something that can be upheld if the child is in danger and has shared this information with a mandated reporter. If it can be reported without it being obvious that the information came from the child, I think that would be the best situation. I have been told of situations where a parent was investigated by CPS and the parent came back and blamed the child for talking. But the child's life had been put in danger multiple times. Of course, the child shut down because they then felt they got their parent in trouble. Obviously, the child's safety should be top priority, but if the situation can be handled without the child being implicated, that would be ideal. Again, I think we could get lost in the details here, and every individual situation is going to be different. This is really up to the discretion of the provider.
Well, thank you again, Julianne. I want to thank all of the panelists for sharing with us tonight. But before we go, I'd like to ask them all to answer one final question from their own viewpoints. And this is the question I'd like all the panelists to answer, going in the order that you spoke. So from your perspective and expertise, what is your vision for a West Virginia that provides comprehensive, affordable, and appropriate healthcare to all its people? So Jeremy, could you lead us off on that one?
Yeah, I think somebody mentioned in the very beginning the idea of the Medicaid buy-in. Over and over throughout the years, I've seen people grow to trust Medicaid. They're happy with Medicaid. They get upset when they have to lose Medicaid. I think the expansion of Medicaid, it makes people happy. And I think that it's the most trusted insurance program in the state at this point. You know, if that's not an option, I mean, the problem is the deductibles in all private insurance plans are just too high. If we can't expand Medicaid, the feds have to step up and do even a buy-in for marketplace plans, buy-in from even Medicare. Those are our two trusted programs throughout the country, and especially here in West Virginia. So if people have the option to do that, I think that would go a long way.
Well, I would definitely have to agree with you, Jeremy, and I believe we will get more into that type of policy promotion in tomorrow's session of this summit. Excuse me. Thank you for that. And next, I'm going to ask Rhonda the same question. I'll repeat the question, Rhonda, just so you, in case you need to remember it. It's from your perspective and expertise, what is your vision for West Virginia that provides comprehensive, affordable, and appropriate healthcare to all its people?
Yeah, Eileen, wow, that's a huge question. I agree with everything Jeremy said. I think that communication is a struggle that we have here in West Virginia. We know that the Medicaid population is chronically hard to reach a lot of times. And so just simplifying and streamlining communication channels with them, I think would help increase user engagement. And I think just as much as we can encourage and promote preventive care and making sure that people are able to see their doctors regularly, I think is really important. And of course, that touches on so many systemic things outside of Medicaid or Medicare alone. I think, you know, it touches on broadband and childcare and living wages and, you know, all the things that help support a healthy and robust society. So yeah, I mean, it can go as big as we allow it to, I think.
That's absolutely right. It's all connected, isn't it? The human infrastructure and the physical infrastructure all needs to be there for communities and families to thrive.
Absolutely.
Julianne, it's your turn. I've done the question twice. I think you probably know it by now.
You don't have to do it again. And those were really amazing answers. I don't know how I'm supposed to follow those up, but I am gonna affirm that I would like to see a Medicaid buy-in as well. That would benefit me personally. A CHIP buy-in would also benefit many families. I know in West Virginia, there are several families that make $1,000 or $2,000 more a year than those eligible for Medicaid or CHIP. but insurance prices are too high for them, obviously. A buy-in would help that. And if we were talking about healthcare dreams here, you know, I would like to see health insurance that covers things deemed medically necessary by a provider without it being questioned. I would like to see them put through what a doctor has ordered without the doctor. I think it should be covered. I cannot tell you how many people I've had conversations with that have needed to leave the state for care because resources are so limited here, myself included. If we can't get and keep us in West Virginia, then let people go out of state if they're willing. Me myself would like to see more integrative and holistic options covered by this great example. It has been used to help treat multiple things. It has been used to coincide with other treatments to help treat substance use disorder. It should be an option. End rant.
All right. Well, thank you very much, Julianne, for that wrap-up question. And you did point out, I think, again, I'm going to start sounding like a broken record, but something we'll probably get into tomorrow is the cliff effect, where people who are on Medicaid or CHIP and make a little bit too much money end up getting cut off of those programs. So a buy-in would be a great transitional thing. And that wraps it up for our panel tonight, folks. At this point, I'm going to turn it back over to Adam, our moderator, so that he can proceed with a Build Back Better video that I think he's going to want us all to view. So.
All right, yes, thank you, Gary. And thanks to our panelists for your excellent insight on these many complex issues. As Gary said, I have a little commercial break for you here, so just bear with me. Can I take just a couple moments to tell you about a bill in Congress called Build Back Better? It could provide more than 17,000 good new jobs to West Virginians. Build Back Better could cut the cost of child care and long-term care, lower health insurance charges, and protect working parents' job security when they need a paid day off to care for a sick child. And Build Back Better gives every working family with kids a tax cut. Build Back Better is paid for by making sure that billionaires and wealthy corporations pay their fair share of taxes. No one making less than $400,000 a year would pay more in taxes. In fact, most would pay less. Senator Joe Manchin has the power to deliver Build Back Better jobs and help working class families. Please get involved by calling his office. Your voice can make a difference. Please click on the link to Phone to Action. Whether you reach a live person or an answering machine, tell the office your name, where you live, and that you want Senator Manchin to support Build Back Better and support fair share taxes for rich corporations and billionaires. All right, I think that was it. And Hunter Starks is up next. Cool last name, but no relation. So take it away.
Thank you, Dr. Starks, the doctor in the room. My name is Hunter Starks. I'm just going to introduce Cody Nunley real quick. Cody Nunley was one of our student interns from Marshall University for the 2021 legislative session. And I just think it's really exciting that we've been able to get students and just everyday people involved in the legislative session. So Cody, before we wrap up for questions, let's hear from you and how you were able to get involved this past year with our campaign.
Hello, I'd like to introduce myself. My name is Cody Nunley. And I want to say thank you for allowing me to speak today. I am a senior in the social work program at Marshall University. I live in Huntington now, but I grew up in Logan, West Virginia. My childhood was complicated because my mother and my father both often struggled with substance use disorder. And by high school, I no longer had a happy home. Those days were effectively over. When I graduated high school, I went to community college, and at this point, I left home and was essentially homeless, living in my car and going to class. However, I was determined to do well in community college so I could make it to Marshall University and pursue a better life for myself. I was accepted into Marshall, and because of my life experiences, I joined the social work program. During this year's legislative session, I became a student intern for Healthcare for All West Virginia, and since then, I have had the opportunity to work alongside members of Healthcare for All on a number of important issues facing West Virginians and voice the needs and concerns of my generation. Advocacy in itself gives every member of the community a chance to be heard. I wasn't always aware of this, however. When I was doing research about the personal income tax bill, I came across an article in the Herald Dispatch that elaborated on the bill. I learned how it would have cut higher education funding and possibly the Promise Scholarship, which is essential for many young people in our state, especially in rural communities. After reading the entire bill, I knew I wanted to stand up for young people like me and their right to higher education. There are many ways to support and promote something you believe in. Advocating during COVID was difficult because people weren't allowed in the Capitol building, but I ended up speaking at a virtual hearing on the bill at a House committee meeting. Next, I spoke at a rally outside the Capitol in Charleston to voice my concerns to the public and to the press. I recently got my first op-ed published in the Charleston Gazette. Once again, I was acting in interest of higher education by supporting the 2-year tuition-free community college part of the Build Back Better plan. Advocating and voicing your concerns about bills that affect you is a right that many have. However, many of us are unaware that we have it. There are several ways to be involved, whether that be talking with your delegates at a legislative meeting or voicing your concerns to the general public. You have a voice, and if you feel strongly about a bill or you want to voice your concern about the same laws that affect you, then reach out to a local organization or take initiative and start a movement. I would again like to take this time to say thank you for allowing me the opportunity to speak.
Awesome. So Cody is a great example of what makes me so the most excited about the Healthcare for All West Virginia campaign, because the whole point is that individuals' voices and our needs need to be heard. Jeremy spoke about a lot about the Medicaid buy-in that's come up a lot. I'm one of those folks who I don't want to lose Medicaid. Medicaid's done great things for me, and I wish that more providers could afford to take Medicaid. I'm just going to open the floor up for questions. I had 2 written down from the chat. One was from Josh Austin. Are there any targeted efforts planned for Medicaid re-enrollment after the public health emergency and MOE concludes? Josh, if you're still on, if you had an individual that this question was targeted to, you could put that in the chat, or if any of our panelists have an answer for this question, that would be fantastic.
I can jump in a little bit. It's a great question, and it's a very big concern. What he's mentioning is right now there's thousands of people on Medicaid that potentially will lose it after the public emergency ends. Right now, it's due to end around January 15th, unless the federal government extends it. At that point, because people haven't been redetermined for Medicaid based on their income in months now, there's a lot of people potentially on Medicaid that may not qualify anymore. Their income may be too high. So there's a lot of people that may end up losing their health care coverage at that point. One of the things that our organization is trying to do is work with DHHR to make sure our contact information is in the letters that they will send out to people, just to let them know if you do indeed lose Medicaid, Marketplace can grant you a special enrollment period to be able to get Marketplace coverage, and you can reach out to our organization for enrollment help. That being said, we all probably need to do a lot of work around this issue to educate people that this is coming. And we're potentially looking at tens of thousands of people that could lose their coverage at that point.
That's yeah, that is concerning. And I hope that the DHHR does pull through and put y'all's contact information in there, because that would help a lot of people. The other comment that I had gotten down was from Laura Foster, and it was more of a comment than a question to Jeremy, just suggesting partnering with Jobs and Hope to reach folks in recovery. I'm gonna give a couple more minutes if anyone has any questions for any of our panelists, including Cody, who shared his story. Just go ahead and drop those questions in the chat and get them answered. I'm just scrolling through here to see if I missed anything. So just a huge thank you to all of our panelists, to everyone who's attended today for day one of our Healthcare for All Summit. Tomorrow, please join us, same time, and we'll be discussing our policies that we're going to be fighting for in the 2022 West Virginia legislative session. And speaking to how you can get involved, like Cody did, to fight for these things that we need for West Virginia. Again, if you want to find us on Facebook and Healthcare for All West Virginia. Thanks everybody again for attending, and I hope everyone has a great evening.